Hello and good morning. My name's Amanda. I'm the Community Outreach Coordinator here at the Missouri Poison Center. And I know it is about spring. We hope that it starts to come pretty soon. And some of this colder temperatures here in Missouri are going away and we get a little bit warmer. We certainly have had the rain this year. So as we look towards spring, we know that with spring comes springtime allergies. And so today we're going to talk about what they are, some of the treatment options, as well as some of the prevention that you can do for yourself or your loved ones. So first, we're just going to get a little background about what seasonal allergies are. They're also called hay fever, and it's a group of conditions that can cause sneezing, a stuffy or runny nose, and itchy eyes. It's usually caused from pollen on trees or in grass or weeds or potentially mold spores. And there are lots of different types of pollen and different things that people can have these allergies from. Tree pollen is usually the earliest culprit in terms of seasonality, and then grass in the spring and early summer, and then ragweed more in the late summer to fall. And then mold spores grow quickly more in the heat with high humidity. So we see that more in the summer. And when the day is windy, we can see that warm pollen continue to surge and potentially be increased with either dust mites or animal dander. So it can be from a number of different things that people have these seasonal allergies. In terms of some of the symptoms that one has with seasonal allergies, we frequently see either a runny or stuffy nose. It could be either. We see sneezing. Often we see those watery, itchy eyes, and that's a common symptom. Sometimes the sinuses and the throat, even the ear canals can be itchy. Congestion or feeling full in the ears. And sometimes people have that postnasal drainage where they feel like they're constantly having secretions. And sometimes we see hives or rash or skin itching. Less common symptoms that can occur are headache, shortness of breath, wheezing, and coughing. All right, let's go through some of the specific medicines and treatment. Obviously, you need to make sure that you consult with your healthcare provider before making any changes to your medicine, even over the counter products or eye products, other cold and cough or allergy things. First, there are some things like nose rinses or sprays. Sometimes that rids the nose from pollen. Many of these contain steroids and can be recommended for stuffy or congestion. There are over-the-counter and prescription antihistamines like Claritin, Zyrtec, etc. And these help with itching, sneezing, and runny nose, but they can sometimes cause drowsiness depending on the type. So it is important, like we said, to discuss this with your doctor or healthcare provider. There are many types of eye drops if you're experiencing that itchy eye watering. Some of these are antihistamines as well, and some are used for dry or itchy eyes. It just depends on the symptoms. There are some things that help with congestion. They're called decongestants, and they reduce the stuffy nose. They're not for people with certain medical conditions, such as high blood pressure, who may be on medicine for that. So it is important before starting any decongestants to specifically discuss your other medications and your healthcare problems. Allergy shots, also called immunotherapy, can be done weekly or monthly, usually in your physician's office. They contain a very small amount of the allergen to help your body build a response to it. And sometimes they may take a while to work, even many months before you start seeing improvement. So these are all different medications, sprays, drops, etc., that can be used for allergies. It's also important to consider that you can prevent some of the allergy symptoms by doing some certain things within your home and out of your home. It is important if you're especially prone to pollen or mold to check some of those reports before going out. Seeing if it's a high pollen day, you may want to consider changing your outdoor plans. The reports can be found in the radio, the newspaper, other news channels. And pollen counts are usually highest at the midday time, so it's better to plan outings in the morning or late afternoon. If those counts are high, you can potentially use your medication a couple of hours before going outdoors as directed by your doctor. And anytime we have dry, windy days, we have an increased risk of allergens in the air. So it's best to go outside after a rain, which helps to clear the pollen from the air. So that's another time you can go out. And keep windows and doors shut during allergy season. You potentially want to use a high efficiency air filter in your home and change them frequently, and to kind of reduce that exposure within your home. If you do go outside, it is good to take a shower, wash your hair, change your clothes, especially if you're doing outside work like lawn mowing, gardening, etc., on high pollen count days, because that just reduces your distribution of those. Of course, cleaning frequently, laundering clothes, and bedding frequently is also important. Kind of those soft surfaces keep that mold and pollen within it. So the more you can do to kind of reduce that through air filters, through reduction and soft surfaces, the better. Of course, the Missouri Poison Center is always available 24 hours a day, 7 days a week for your questions about medication or other household products. You don't have to have an emergency to call the Missouri Poison Center. You can call with just those questions about safe use of medicine, dosing schedules, etc. We can certainly help you through this springtime allergy season for all those medication questions and concerns. Otherwise, feel free to reach out to us for any other exposures that you have this spring or summer. We are here 24 hours a day, 7 days a week. And please save the Poison Helpline in your phone as a contact ahead of any time that you might need us. That phone number is 1-800-222-1222. Have a wonderful spring and enjoy your outdoors.